This lecture is part of Public Health, PHA 567B, and in this lecture we will be talking about disease prevention. Um, in the order of things, we talked about determinants of health, then we talked about health promotion. Now we're going to talk about disease prevention. This is the outline. First, we're going to start talking about the health continuum. Then we're going to talk about the disease prevention levels, primary, secondary, and tertiary. Then we're going to talk about the types of disease prevention. Um, this figure is supposedly showing the health to death continuum and starts with perfect health, then moves into moderate health, and then to marginal health. So at these three levels, a person is still considered otherwise healthy. Then a person is exposed to something. It could be a lifestyle risk factors, and therefore you're moving into being at risk. You're not diseased yet. Then you move into actually having the early stages of disease, then the late stage of disease, and you end up with death. Maybe what is missing here before death, you can add disability. That can also be part of the continuum. Now, this continuum is important because it's going to help us visualize where health promotion is and where disease prevention. So, health to death, disease prevention is concerned with individuals that are most likely to develop disease or injury, causing morbidity and or premature death, both of which are preventable. So, when I'm with premature death in this concept, we're talking about death that in principle it could have been preventable. Or a morbidity that could have been prevented if somebody has taken other types of behavior. So, how do we differentiate between disease prevention, which is the topic of this lecture, and health promotion, which was the topic of the previous lecture? Hala, one way to think about it is while the second, yani the health promotion, maximizes health, the first, which is disease prevention, minimizes risk of disease and premature death or disability. However, there is some level of overlap, and I'm going to show you that in the second slide. So again, this is the health to death continuum. As I mentioned previously, perfect health, moderate health, marginal health, all of this is, if you're working here, then it's a health promotion. Because if you remember, the definition of health promotion is to maintain and improve. So you're either maintaining a perfect health, or you're maintaining in a moderate health so that it doesn't move to marginal health, or you're improving towards a perfect health. But if you over on the side of where exposure starts, that's where health promotion and primary prevention, primary and disease prevention, they overlap. So sometimes activities are not clear if they are health promotion or if they are disease prevention because they would be overlapping right there. So primary prevention is right where you don't have the disease yet, but I'm trying to prevent the disease from occurring. So you are at risk. However, I'm trying to reduce the chances of you actually getting the disease. Whereas once you have the disease and it's early stages of the disease, a secondary prevention, that's where I try to catch you early on so that you do not develop late stages of the disease. So that is secondary prevention. And tertiary prevention, you have the disease, it's a full-blown disease, but I'm trying to prevent you from developing um, uh, side effects of the disease or complications of the disease or disability due to the disease. And I'm trying as much as possible to bring you back to a state where you live your life as much normal as possible. Okay, so let's go back to our lecture. So the levels of disease prevention, avoiding preventable disease, injuries, and premature death is considered the cornerstones of public health philosophy and action. We have multiple levels, like we've seen with determinants of health, and as we've seen with health promotion, the individual level, the community level, the national level, and the global and international level. So we're going to go over them very quickly because the focus is going to be on primary, secondary, and tertiary. So at the individual level, for disease prevention, focuses on behavior that puts people at risk of being exposed to. So again, it's you focus on somebody that individuals themselves are doing, like a disease-causing agent, a behavior that deteriorates health. The example here is skin cancer. You reduce exposure to UV light by providing clothing, sunscreen, hats, and shades. So you're making the individuals themselves do something so that they're not exposed. Okay. At the community level, involves identifying groups at risk of exposure to disease because of where they live or the type of work they do. So it's no longer individual, it's a community as a whole. So, for example, if you remove contaminated water or if you remove some kind of building material, مثلا asbestos, it's not about the individual, it's about a community. But you're preventing them for developing diseases. You create areas for exercise or grow fresh vegetables. So here, areas of exercise, you're thinking, well, this is a health promotion. Yes, or it's a disease prevention if people haven't developed the disease yet. So that's where one of the places where they overlap. Education and campaigns increase access for screening, early treatment, كمان hold they are disease prevention. So for example, for the skin cancer, you provide education, you cover public pools, you allow swimmers to wear t-shirts, sunscreen, you allow them to wear, you provide sunscreen for free, you do checking on tanning salons, you plant trees so that people have some shades to sit under. At the national international level, focus on regulation of business, for example, disposal of waste to prevent contamination of water, soil, and even air. And here you have a list of examples: non-smoking ordinance, restriction of alcohol sales, health professional license validation, manufacturer regulation, airing educational material on national TV and radio, restrictions on advertising product that may be harmful to health, such as alcohol and tobacco. Um, so that takes us back to the type of disease prevention. There are three levels: the primary, the secondary, and the tertiary. So you begin with avoiding exposure, which is the primary, and that's why it's red, moves to early detection, which is secondary, and it's blue, and ends with effort aimed at returning to health as much as possible, which is tertiary prevention. So primary prevention, the goal is to reduce the probability of developing the disease in a specific population. So you're trying to reduce the risk. So in primary prevention, people don't have the disease yet, but they are at risk, and you want to stop them. The target population is those that are at high risk. Example, influenza. The target population is quite large, but for a rare disease, the target population could be a mere fraction of the total population. You can think about COVID-19. Um, the target population for primary prevention being preventing people from actually catching the virus. And you do that through quarantining, you can do that through vaccination. So what you're trying to do is you're trying to stop people from catching the disease before they actually develop the disease. So that's primary prevention. Mention هيك, I think we're going to see it in some of the slides. Um, the hallmark or like the most important primary prevention is vaccination. You vaccinate mean people that are healthy. They must surmount the disease, but why you vaccinate them? So that they do not get the disease. So outcome and evaluation, the real outcome is to reduce the number of exposed, but sometimes it's difficult. So the reduction in number of new cases is used as a way to evaluate the outcome. Primary prevention sounds a lot like health promotion, as I mentioned, and sometimes the two are not distinguishable. But in general, primary prevention promotes health to resist disease, whereas health promotion promotes and maintain health in general. So you may ask yourself, is this activity making the person healthier or is it protecting them from disease? Yani, vaccination, you're not making people healthier. Vaccination is not a health promotion. Vaccination is a disease prevention. Primary prevention and intervention. Intervention to reduce the exposure. مثلا for malaria, you drain water where mosquito breeds. For influenza, you isolate infected people to prevent contagion. COVID-19, we've seen the quarantining of people right at the beginning, where people were coming from outside Lebanon with the virus. They were asked to, quarantine themselves for 14 days, not to get infected with anybody. The idea is to prevent other people from catching the disease. Intervention to increase resistance, مثلا vaccination. So going back to this map, uh, here we have primary prevention in red because this is what I'm talking about. And in every time you have examples of individual, community, and national activities. So at the individual level, increase exercise, improve diet, quit smoking, reduce drinking. At the community, remove pollutants, ensure walking and exercise in place, promote sales of fresh produce, identify at-risk group. At the national, awareness and education campaigns, funding for research. Again, you may be looking at these and saying, well, they look like health promotion, and you wouldn't be wrong. Again, health promotion, primary prevention بيشبهوا بعض a lot. Now, but for secondary, that's a very different situation. After a group has been exposed, the goal of prevention are to to reduce the likelihood that the exposure will cause the disease. And in the event it does, then reducing the severity and length of the illness. So the target population is a subset of the target population of the primary population. Screening who will hallmark of secondary prevention activity, because screening is typically catching people early on. A lot of people may have hypertension or diabetes, they do not know, they're still in the early on stages of the disease. ما عندهم signs and symptoms. You catch them early on because treating them early on, or providing them with the health lifestyle health behavior might help them prevent the early stage to develop into a late stage. You can use laboratory tests, of course, for screening. بعد عم نحكي screening can be done to find exposed individual, but it can also be done to find early disease. Intervention to prevent development of the disease, post-exposure prophylaxis. Example of PEP مثلا ciprofloxacin for meningococcal meningitis prevention. For heart disease, reducing factors to slow down the progression. Outcome and evaluation, you look at the reduction incidence of the disease, you look at the number of exposure or early disease detected and treated, you look at the reduction in the severity of the disease. Again, we come back to the slide. This time secondary prevention is highlighted in red, and here you have examples of things that can be done at the individual, community, and national level. At the individual level, في عنا monitor for early symptoms, screening task, seek care early. At the community level, provide access for screening and early treatment, identify groups with early disease, monitor behavior and spread of the cancer in community, limit or control spread of cancer in community. At the national level, monitor trends in the country to identify groups and sites or higher incidence, fund research to develop tests to identify cancer. Then we move into the tertiary prevention. The goal is to reduce mortality and morbidity associated with the disease and return the person to a state of health that is as close to normal as possible. So the target population is again a small subset of the secondary one. Those exposed to agent and actually develop the disease and now at risk of developing complications. So that's the idea of the tertiary prevention. Preventing complication, preventing disability, and preventing what we call premature death. That's what the tertiary prevention is all about. Preventing those that have diabetes to مثلا have necrosis in their legs, or losing their sight, or becoming unable to function in community. So we're still with tertiary prevention, treating to cure and avoid complications or death. So you reduce death, you reduce complications, you reduce disability, and maybe you can cure if you can. At community level, it works on ensuring access to proper medical treatment needed. Example, antibiotics to treat infection, blood sugar control in patients with diabetes to prevent damage to the kidneys, eyes, and heart. Common part of tertiary prevention is rehabilitation for the permanent disability, maximize functioning and achieve a more normal lifestyle. Physical and occupational therapy are used to help individuals to learn new ways to perform daily activities. Rehabilitation for cerebral vascular accident and spinal cord injury as an example of tertiary prevention. So the outcome and evaluation: reduction in premature death, number of survivors who develop the complication, this should decrease, number of cases cured, this should increase, and at community level, access to medical care and ability of disabled person to continue being active member of society. So again, here you have your tertiary prevention highlighted in red, and at the individual level, seeking medical care, monitor for signs of adverse reaction for treatment. At the community, provide access to competent medical care, support groups for patients and families. And at the national level, funds research to develop safer and more effective treatment, seek treating requirements for healthcare providers that provide care. Then I'm providing a summary table that shows primary, secondary, and tertiary, and it summarizes mini target population, what is the goal, what is the rationale, the kind of intervention, and the way of evaluation. And last, as in previous lecture, we have the pharmacist and their role in prevention, what kind of things they can do and how can they be part of an active prevention campaign.